So when we talk about the cardiovascular system, we're referring to the heart and the blood vessels as the major organs. So the heart, arteries, veins, and then their job is to basically transport blood. So the heart generates the pressure to move the blood through the blood vessels, and then the blood vessels are just the highway. Bringing oxygenated blood to the tissues are the job of the arteries, except for the pulmonary artery. And then the job of the veins is to carry blood back to the heart to be reoxygenated by the lungs. So the heart is a muscular pump. When we look at it, overall, its function is to, again, generate that pressure by squeezing, by contracting. So when the heart contracts, it generates pressure in the heart, so blood flows out. And then it also separates the blood. On the right side of the heart, we know that that blood is pumped with the right ventricle pumps, contracts, it sends it to the lungs. The left side of the heart, when it contracts, the left ventricle, it sends it to the aorta, which goes to the body. So we say the right side of the heart is the pulmonary circuit, and the left side of the heart is the systemic circuit. So we have one-way blood flow through the heart because of valves. So the key structure that makes sure that blood doesn't go back to where it came from are the presence of those valves. So they close. When blood flows backward, it flows onto those valves and shuts them. And that's what we hear when you hear the lubbed up of your heartbeat. That's the closing of the valves as blood flows backwards when the heart relaxes, or when the ventricles are beginning to contract. We'll look at this in an animation. Those valves are forced shut. So that is what makes sure that blood doesn't go backwards. So if you have a leaky valve, that can be dangerous because blood is going back to where it came from, and that's not ideal for good oxygenation. So we'll talk about that too. And then regulating the blood supply. If you're exercising, obviously the heart is going to beat faster and stronger to get that blood to the tissues when you're exercising. When you're laying in bed, the heart's not going to beat as fast and as strong because you're relaxed and the tissues don't need as much oxygen. So it can increase its action, the heart can, based on what the metabolic needs of the body are. For example, needing more oxygen. So it's a two-sided pump. Right side is for the lungs, left side is for the body. So pulmonary is the right side, systemic is what we use as a term, is the left side of the heart. So we talked about this in lab. The heart is in the center of the chest. It's about the size of your fist. And it's slightly tilted to the left. That apex is on the left side, so you can tend to feel that on the right side of your chest. And we can put a stethoscope over that area and get a really good heart rate there. So that's why we put our left hand over the left side of our hearts, because it's tipped to the left where that apex is. We call that pulse an apical pulse because it's over the apex. So the heart is surrounded by a sac called the pericardium. Again, we talked about this in lab. So there's nothing more that you need to know about that for lecture purposes. It's just a review, that it's surrounded by these membranes that keep it separated for infection purposes. We also talked about the epicardium, myocardium, endocardium. Just know that the myocardium is the contracting layer, so that's where the force is generated. That's where the action potentials are generated from cell to cell, is in the myocardium. The epicardium is just a protective layer, and the endocardium just provides a nice smooth surface to reduce friction as blood flows through. So we need a really slippery, smooth surface so blood doesn't get stuck or settle or clot, right? But if someone has endocarditis, an inflammation of that membrane lining the chambers, that can be dangerous and can affect the heart function. So that's a very serious condition, and it can happen when there is some kind of infection in the body. And I think I already talked about in lab, intravenous drug users are at risk for endocarditis because the particles in those IV drugs can cause infection and inflammation in the heart. So the heart wall has these little extensions here called trabeculae carnae. And what that does is just cause a little more turbulence inside, so the blood continues to flow and move. It's not, again, pooling or sitting, so it just provides kind of a uneven surface to keep blood moving inside the heart. We talked about the chambers. The atria are the receiving chambers. Blood comes into the atria. Veins, major veins supplying the heart are on the right side, the superior and inferior vena cava, serving the right atrium. And then the pulmonary veins serve the left atrium, so that's oxygenated blood coming into the heart. But just remember, the atria are the receiving chambers. So if they're receiving chambers, that means they have to always have veins leading to them, because veins carry blood back to the heart. And what are they carrying it to? They're carrying it to the atria. So the superior inferior vena cava are both veins leading to the right atrium, carrying deoxygenated blood, right? And then the pulmonary veins, there's 4 of them, they lead to the left atrium, and they carry oxygenated blood coming back from the lungs. So the atria are the receiving chambers of the heart, and they have veins leading to them because veins carry blood to the heart. And then the ventricles carry blood away from the heart, so when they contract, blood is carried away from the heart via arteries, right? So the major arteries leaving the ventricles, in the right ventricle, it's the pulmonary artery, left ventricle, it's the aorta. And that's what's nice about your worksheet in the back of your packet. What page is that worksheet on? The one with the heart diagram? 622. Yeah, page 622 has a really nice heart diagram for you to label and to kind of review all those structures again. And I'm not going to test you on the structures for the lecture exam, but you have to understand the structures to know the function. So that's why it's nice to have the lab before the lecture, so you have some of those things down already. Remember that the ventricles are muscular. The left ventricle is much thicker than the right ventricle, so there's more pressure on the left side, but the volumes on right and left are the same. And that's a key concept, and that could potentially be on the test. So volumes are the same, pressure is higher on the left. So on that worksheet on the bottom, there's some true and false questions. Number 1, 2, and 3. So you should have the information to properly answer those, true or false. So right and left sides equal volume of blood, but the left has more pressure and it has a thicker wall, the left ventricle. So let's look at the coronary circulation. When we talk about coronary circulation, we're talking about the vessels that lead to and from the heart muscle. Because in order for the heart to do this awesome job of contracting, 80 times a minute for your entire life, if that's your average heart rate, it needs a good blood supply to do that. So the coronary arteries are what supply the heart muscle. So that's what's shown in red here in the top of your slide, those coronary arteries. And where do they come from? You can see they come from the base of the aorta. They're kind of shaded out because they go behind the pulmonary artery. But they come from the base of the aorta. So we know that the left ventricle has this freshly oxygenated blood. It contracts, sends it through the big ascending aorta and aortic arch and all the branches. But right at the base of the aorta are these left and right coronary arteries that right away go to serve that heart muscle itself. So if we get a clot in those coronary arteries, the heart can't do its job, right? If it doesn't have oxygen, like any tissue, if it doesn't have an oxygen supply, it can't contract. So you have 4 to 5 minutes, you'll have some hemoglobin unloading of the blood that is present on the other side of the clot, but once that clot is stuck there, there's no more oxygen delivery, and that heart is going to stop its function, and that's what happens to people that have heart attacks. So the left coronary artery supplies most of the left ventricle, the left side of the heart, which is, again, the important part that feeds to the tissues, right? It needs to generate a lot of force. So if a person has a clot in the LCA, that's called the widowmaker. People don't survive those clots because most of the heart is shut down. Some of the other vessels, when they get clotted, there's still some blood supply to the heart, so they're going to feel chest pain, they're going to feel pressure, they're going to be short of breath, they're going to have all the symptoms of a heart attack, nausea, sweating, left arm pain, left jaw pain sometimes. So they're going to go in and be seen, and sometimes you can get in there and fix that before they actually die from their clot. But if it's right at the base of that aorta, coming off of the aorta, clots right away, that's a bad clot. And that's what happened to a neighbor of ours. He was found in the front yard with a massive heart attack to the clot in the left coronary artery while he was mowing his lawn. So the cardiac veins all drain used blood from the heart muscle tissue and it drains to the coronary sinus. So that's kind of like the collecting pool of used blood from the heart muscle. And the coronary sinus leads to the right atrium, because that's where blood returns to the heart to be oxygenated again. So what I'm going to ask you to know are the major, points of entry for these vessels. So for the coronary arteries, where does that blood come from? The aorta. And the cardiac veins drain first to the coronary sinus and then to the right atrium. So those are the two major parts I want you to know for the cardiac veins: the coronary sinus and the right atrium. Okay, so myocardial infarction is, or MI that's called, it means to plug or cram. So it's referring to a clot. It's from the Latin term. And angina, or angina, depending who you talk to, is due to lactic acid buildup when there's a clot and the body can't undergo, those cells, those cardiac muscle cells can't undergo regular aerobic metabolism because there's no oxygen, so they switch over to lactic acid fermentation to produce a little bit of ATP, but it's not enough to keep the heart going and the muscles of the body moving, so people are very short of breath. They have that chest pain, pressure. It's not always pain. Some people just feel pressure as that sensation of that clot. So you have to ask people, are you having any chest discomfort rather than are you having chest pain? Because some people are like, oh, no pain, just a lot of pressure. Oh my gosh, that's concerning. So we want to make sure we ask about discomfort. So we have these valves that separate the chambers and also separate the major arteries from the chambers that blood comes from. So the AV valves are the left and right AV valves. Those are very large. They're between the atria and the ventricles. So when the atria contract, they finish filling the blood, the ventricles with blood, and then the ventricles start to contract, and that's what pushes those valves shut. And that's the first heart sound, the lub, when the ventricles just start to contract. And then we have the valves at the base of the arteries, the aortic valve and the pulmonary valve, and that prevents blood from going back into the left and right ventricles from those vessels. So when you think of how the heart contracts, the atria both contract together to fill the ventricles, and then the ventricles both contract together to send some of that blood to the lungs and the already oxygenated blood to the body. So it's a two-sided pump that is pumping at the same time. So it's not like right atrium, right ventricle, left atrium, left ventricle. That's not how it works. That's how blood flows. One blood cell, if we followed it through, would go in that direction. It would go to the lungs too. But when it contracts, if you look at the heart in a person's body, how it operates on a minute-to-minute basis, it's atria both contract, ventricles both contract. So it's a side-by-side muscular pump. And I believe that is also in your worksheet somewhere. If it isn't, just make sure you know that concept. So the valves. When the AV valves close, that's the lub. So the lubbed up, lubbed up, lubbed up. AV valves are closing, gives you the lub. It's called the first heart sound. We call it S1. And then the DUP are those smaller valves in the pulmonary and aortic, in the pulmonary artery and aorta. When those valves close, that's when the heart is beginning to relax. When the ventricles relax, the blood flows backwards a little bit toward the ventricles in those vessels, and it closes them. And that's the DUP. So if you think about lub, has kind of more vibration to it. It's larger valves that are closing. That's the first heart sound, the big AV valves. And then the DUP are the little valves of the pulmonary artery and aorta. And there's a third heart sound that can sometimes happen when there's an extra turbulence in the ventricles, but that's not something that's typical. So you're going to just listen for the lubbed up, the S1 and S2 heart sounds. So I have an animation that I want to show. So if you go to this website, this YouTube video, it really shows the action of those valves, showing that the AV valves close when the ventricles start to contract, And the pulmonary and aortic valves close when the ventricles are relaxed. So the S1 and the S2 heart sounds. So let's go back to our notes now. This website is really nice too. It has animation showing blood flow through the heart, so you can type that in separately and work on that. But this is something that you really need to know for the test, is order of blood flow through the heart. So we're going to start with the vena cava always. So we're going to start as blood enters, so that's step 1. So blood is simultaneously from both top and bottom of that right atrium flowing into the right atrium, deoxygenated blood. But here's the key thing, is it flows directly through the open AV valve into the right ventricle. The atria doesn't contract until the ventricles are almost 80% full. And then the atria contracts to top it off. So most of the ventricles fill passively through open AV valves, like filling a swimming pool but standing there with a hose. The atria don't contract until the end, that last 20%. So it comes in through the vena cava to the right atrium. So let's just follow one red blood cell through the heart. Then it goes to the ventricle. So it goes through the right AV valve to the right ventricle. As both ventricles contract, this blood cell that's in the right ventricle is going to be pumped to the lungs. It's going to go through the pulmonary valve, out the pulmonary artery. So we're over here already, because it went from the vena cava to the right atrium, through the right AV valve to the ventricle, then out to the pulmonary arteries, to the capillaries of the lungs, and then from the capillaries of the, well, this is not in a good location, is it? Oh my goodness, that's terrible. Is it in your notes too? Oh, that's a bummer. Well, let's refer to your textbook then. There's a really good picture of what I'm going through here in your textbook. On page 681 in your textbook is where you'll see this diagram. But if I follow it through, it's just a repeat of what we see up here, but we're on the left side of the heart, right? Because once it goes to the lungs, it comes back to the pulmonary veins. So that's what these are on the back of the heart. So it goes to the pulmonary veins, to the left atrium, then to the left ventricle. You can see that here, pulmonary veins, left atrium, left ventricle. The left ventricle is contracting, and then it goes to the aorta, and then to the rest of the body. So know that order of blood flow through the heart. And in that worksheet that I referred to that has a diagram of the heart, draw arrows to show the direction of blood flow. And that'll kind of help you remember what's coming and what's going out of those chambers and vessels. So this is definitely on the test. I'll ask you a couple of questions of what's going where after it leaves this chamber, enters that vessel. So I would recommend doing that worksheet and having that ready to go.